I'm Ilona Galarde, and today I'm interviewing Dr. David Dighton, a London and Nicosia-based cardiologist. Welcome, David.
Thank you for inviting me.
Our today's subject is a coronary artery disease.
An interesting condition.
As I understand, the coronary heart disease is a major cause of death in the Western world.
Yes.
So what exactly is it?
Well, it affects middle-aged people and older. It's quite rare in younger people in their 20s or 30s, but it's actually the arteries of the heart. There are two, which fur up with cholesterol. I use the word furring because it's like the pipes in a central heating system, where chalk develops inside and narrows the tubes. In the case of the coronary arteries, the narrowing is caused by cholesterol, mainly cholesterol. There are other bits like chalk, but it's the narrowing that causes less blood to flow down the coronary arteries, which themselves give oxygen to the heart muscle and make it pump. So they're rather important. Your life depends on the flow down these two coronary arteries.
And does this cholesterol accumulate because the blood cholesterol is too high?
Partly. I think there's a controversy about this, but I personally think that it's mainly genetic, and your genes make cholesterol form within the inner lining of the artery. I think from many years ago we used to think that the high cholesterol deposited on the inside of the arteries in the same way that snow would fall onto the ground. We thought that the cholesterol just fell out of the blood and onto the inner lining, but that's too simplistic. It may be 5% of the problem, but the main problem is that it develops in the cells on the inner lining of the arteries, and that's really under genetic control. There are many other controls like smoking, and a lot of people believe in a form of inflammation or soreness within the arteries, and others put a lot of store on what are called antioxidants in food, and these are meant to prevent the furring. But the evidence is a bit shaky. It mainly develops, I think, because it runs in your family. It's under genetic control.
So is it because people eat too much cholesterol in their food?
We used to think so, and it is in a way logical. 30 or 40 years ago, the story was that if you eat too many eggs, which have cholesterol in, the cholesterol would get into the blood and then it would fall onto the walls of the artery, making it narrow. Now, that is logical, but it happens to be wrong, because biology doesn't work like that. It's more of an active process. Yes, there is to some extent, if you eat high saturated fatty food, that's animal fat, it does convert itself into molecules which will somehow get into the artery wall. We know that's the case from animal experiments, so there is an element of that. But as I said, the major element probably is genetic.
And so if it's genetic, it must run in the families?
That's right, it does, very strongly so. Rather like high blood pressure and migraine and maybe eczema and asthma. These are very strong genes. So if you have one parent with coronary artery disease, and those parents of yours have 4 children, then one of them will get it, almost certainly. So it's a 1 in 4 chance. If you have both parents with coronary artery disease, then 8 of their 10 children, if they had 10 children, 8 of the 10 children would likely get it as well. So, and you can see this running through families. Every doctor knows this, that it's quite common to have a family history of heart disease if the patient in front of them has coronary disease. We all can observe this. It's commonplace every day. We all know it.
For example, how would I know if I would have a coronary heart disease?
Well, for a start, it would be very unlikely because you're quite young. But suppose you were an older person asking this question. I think the important answer is you would not know. And that's one of the big problems with coronary disease, that most people that have it do not know that they have it. So it presents a challenge for us doctors to detect it before it gives trouble. And the sort of symptoms we're looking for are breathlessness, tiredness, and of course chest pain will occur. But unfortunately it occurs very much at the end of the process. That's when the arteries are really quite narrowed.
So these symptoms come as an artery narrow, I suppose?
Yes, we think that the very first symptoms occur when the arteries are about 85% narrowed. If they're 75% narrowed, you would never know you had it. But at 86%, you do, because then you might get breathless and you might get a tight feeling across your chest when you walk. That's called angina. It's a tightness in the chest when walking or getting emotional. But really the arteries have become quite narrow by that time. And the real challenge for us doctors in working in the field of cardiology is how do we detect it before then so that we can then give treatment to prevent it.
And how quickly does this narrowing develop?
Well, that's a question we don't know the exact answer to, but I myself have been watching the furring processes, atherosclerosis as it's called, in the neck arteries for the last 15 years. I've been following this in about 5,000 people, and I know that it's a fairly slow process. I would say that it develops significantly with somewhere between 1 and 3 years. So you might go between 75% and 85% within a year or two. It's fairly slow, but it's quite definite.
So, as I understand, it must be of vital importance to stop it.
Yes, if you don't stop it, then patients will develop angina and they may have heart attacks, which are the problems that occur. We do know that you can stop it to some extent with exercise, strong exercise like rowing and playing squash and marathon running. We know that some foods are good for it, those that contain polyunsaturated fats like fish oils, and I think probably there are other chemicals in the food like selenium and zinc which may have a positive effect, making a difference between ordinary diets and the Mediterranean and the Far Eastern diets, which contain a lot of not just those metals but also things like arginine and taurine. But then we have drugs like statin drugs. There are several of them, about 4 different ones. There's rosuvastatin, atorvastatin, simvastatin and pravastatin, all of which I have seen with my own eyes stop the progress of the furring in carotid arteries, and I think probably also in the coronary arteries. So yes, that is a vital question. How do you stop it? There are different answers for different patients because they have different requirements, but that is the job. Once somebody's had heart disease, we want to stop it because we cannot reverse it. It will not reverse, it stays there. If it does reverse, it reverses very, very slowly indeed, about 1% per annum, which is just too slow for practical purposes.
Is there any way of telling who will progress?
Well, the perceived wisdom is that those who do not exercise and those who smoke will probably, and those who have a high fat diet will progress. But I'm not too sure that that's the case. In these people that I've been observing, it seems to be more that it's in the family history. I'm fairly sure the rate of progression itself is a genetic factor. There are certain races I have observed who seem to develop it faster than others, especially in Asians, and to some extent in Mediterranean people. They seem to develop it very fast, but this is very loose. I wouldn't like to be to seem very confident about this. It's an open question. Who progresses fast? We just have to observe it and see. There's no easy way of telling, really.
So does that mean you are not what you eat?
Well, yeah, it's been said for years, you are what you eat. I'm sorry to say that I don't agree with that at all. I think it is a 5, 10, 20% factor, but the genetic processes here are very strong. A bit like Star Trek saying the force is strong. Well, the force of genes in terms of the furring of arteries is very strong, and I'm not sure to what extent diet can predict it. I think you could say that if you don't have the genetic pattern, that there is no food that can give it to you. If you have the genetic pattern, then and you are careful with the food, I think that you can achieve some delay in the process. But as far as causing it or preventing it, I don't think food is strong enough. It's a genetic process which is very complicated, and it needs powerful treatment like statin drugs, which interfere with the body's metabolism, to have any chance of stopping it. I think that's roughly where we are at the moment.
How would I know if I was prone to artery furring?
Well, a lot of people think that it's their blood cholesterol, and it's important to explain that in large populations of people, the average cholesterol level does predict how many heart attacks you're going to get. But in an individual, it doesn't really tell you anything. For instance, if you take 100 people with coronary artery disease and look at their blood cholesterol levels, only 60% of them will have a raised blood cholesterol. If you look at the more complicated forms of cholesterol, the subfractions, which we call HDL, high density lipoprotein, or LDL, then I think there is a tendency for normal people without coronary disease to have a high HDL cholesterol. But that's about the only thing you can say. At an individual level, the blood cholesterol is fairly useless. So what I do in my patients, if they ask me this question, am I liable to get this? I scan their arteries to see if the furring process is there, and I scan them repeatedly to see if it's progressing. That, as far as I'm concerned, is the only genuine way to find out.
And how would you do that? How would you scan the arteries?
Well, I use ultrasound in the first place because it's harmless. We use it for scanning babies in the womb, for instance. It's the same process. And I usually scan the carotid arteries, which are the neck arteries, because it's been shown in many studies that these arteries are the first to fur up, in many cases, not in all cases, but in most cases. So I start with that.
And if artery scan shows a problem, what do you do then?
Well, I'm taking the patient as an individual. I mean, if they've got a strong family history of heart disease, and if they've had an exercise test which isn't quite right, and they've got furring in their carotid arteries, I will then do a CT X-ray scan of their heart, which shows how much chalky material is in the coronary tree. And if that's very bad, we may go on to do an angiogram, which is an invasive test where we put a tube into the heart and we inject dye and take pictures of the actual coronary arteries. But we use an escalating system. We don't do everything on everybody. We start with the artery scan. If that's abnormal, we do a CT scan. If that's very abnormal, we then do an angiogram. So it can get a bit complicated, but that's what we're here for, to try and diagnose it before trouble occurs. But of course, not everyone is interested in doing that. As we say in English, it's better to look before you leap. But not everybody agrees with me, especially doctors. They think we should wait for trouble to occur. I personally don't agree, and nor do my patients, but there are several different cultures here, those who wait for trouble to happen and those who look for trouble before it happens. It's a cultural thing.
Is taking a statin the best way to stop it?
I think it is. There's an enormous amount of evidence that statins work. I'm also interested in various nutrients in food that might stop it, but at the moment I don't have any proof of this. It's a bit difficult to find proof. Although we do have proof that Mediterranean diet and perhaps the Far Eastern diet reduces heart attack rates. So I'm fairly sure that there are nutrients in food which also stop it, but they would be secondary to taking a statin. Take a statin first and then get the diet right as well.
How do statins work?
They stop by stopping or reducing cholesterol production. Now they do this very effectively in the liver, and the liver produces cholesterol which then gets into the blood. So they reduce blood cholesterol level. But that I don't think is quite as important as what they do in the arteries, because they work directly on the inside of the artery to stop the cells there producing cholesterol, which causes the narrowing, which gives you coronary disease. So they actually work directly on liver cells and on artery cells to reduce the amount of cholesterol being made. Now, food can do this to some extent, we know from animal experiments, but statins are the strongest that we know of.
Please tell me about the heart attacks in angina.
Well, classical angina, which was described 250 years ago, where a patient walks and gets a tightness across the chest, they stop and it goes. This is due to an 85% narrowing of a coronary artery somewhere. It can be on the right side, the left side, anywhere really, but it's got to be that narrowed. A heart attack is where that artery actually blocks. It doesn't always block with more cholesterol, it can block with clotting. The last bit of the artery narrowing is usually a clot, because on the inside of the artery there's a bump of cholesterol which breaks open and clot forms in this fissure and fills the artery and blocks it. And after that no blood can get through, the heart muscle dies a bit, and that is what we call a heart attack. So it's all really based on coronary artery disease.
Is the furring just cholesterol?
There are some of these plaques, that's little bumps in the artery, which are pure cholesterol, or almost pure cholesterol. But most of them have got a chalky, bony material in them. It's actually a chemical called calcium apatite. It's a bit like bone. And then the other component is scar tissue. The one that is more or less complete cholesterol are a bit dangerous. We call them vulnerable plaques because they can very easily break open, a bit like a spot on the skin where yellow stuff comes out. Almost the same thing occurs equivalently in arteries. And if that occurs, a heart attack can really be very sudden. It opens, this cholesterol stuff, which is a bit like soap, oozes out, clot forms, and straight away a heart attack may occur. So we are a bit worried about these because they're more difficult to detect. The chalky bits show up in the CT X-ray scan that I mentioned before, but these vulnerable plaques, which have no chalk in them at all, probably do not. So that's another reason why we sometimes take the testing further.
Now, can the furring be reversed?
Well, I think if it's full of cholesterol, the statin drugs may reduce it. But if it's full of chalky material, then not, because these are old plaques of cholesterol that have turned into bone and chalk, and I don't think they're going anywhere. I think they more or less stay. So yes and no is the answer to that question.
So prevention is the only option?
Yes, I think it is. We have to detect it early before it causes trouble and step in before it gets too bad. We can't really rely on reversal. Reversal, even if it occurs 1% per annum, is just not enough to be effective, even with the best of drugs. So prevention really is the only practical option, yes.
Do you only treat people with a high cholesterol or waiting until they have a heart disease?
Well, there is a worldwide consensus that we should treat people that have a high cholesterol. And there is nothing wrong in that. Governments treat whole cities and whole nations with high cholesterol. And the fact is that if we bring the average cholesterol of a nation down, there will be fewer heart attacks. But for individual doctors like me, I tend to treat them, especially if they have carotid artery disease and other diseases of the arteries, as an individual. I'm not so persuaded by just the high cholesterol. If they have a high cholesterol and normal arteries, then they have an option not to be treated because patients don't want to take treatment. If they have a high cholesterol and artery disease, I don't think they have any options. They have to take a statin. But anyone with carotid artery disease, for instance, or coronary artery disease, absolutely should have a statin. They are so important in the further prevention of coronary disease, and they stop the progress. But when you have a person with a high cholesterol and more or less normal arteries everywhere, that's a big question. Should we treat them with statin drugs or not? Well, I give patients the option. Some who don't like drugs will refuse it, and others may want it to get the best of prevention, but they cause so many side effects that a lot of people give them up. So it's very controversial, this, but I myself, in an individual with no carotid or coronary disease, I would not give them a statin. I only give them a statin when there's evidence of some artery furring. But that's against the rules, mainly because the NICE organisation in the UK and many other, the American medical associations, would all agree that high cholesterol should be treated. But to be honest, it's mainly advice for populations, for large groups of people. It really isn't advice that works on individuals. But these people are making rules for the population, for people in general, so we have to take them seriously. But if it were me, I would only want to treat it if my arteries were furred. I wouldn't just take it because my cholesterol is raised. But I have to say that's my advice is a very personal advice, it's not general advice. Patients must make up their own mind after discussing it with their doctors. That's the best way forward, I think.
So my final question then would be, shall I get my arteries scanned or cholesterol measured?
Well, you can get both done, of course, but the most important one is to get your arteries scanned, because there's such a strong association between furring in these arteries, especially even the neck arteries, and actually having a heart attack or getting angina or even a stroke. It has been said that if you have furred arteries, you have a 1 in 4 chance of developing a heart attack or something like it within 5 years. That sort of risk is not associated with a high cholesterol, although in general there is a greater risk, but it's not as good as that. So I would say get your arteries scanned first, and if they are abnormal, then get your cholesterol done.
All that remains is to thank you for watching and for Dr. David Dighton coming to help us understand about the coronary artery disease.
Thank you for inviting me. It's been a pleasure.
We would like to thank Palm Beach Hotel in Larnaca, Cyprus for allowing us using their facilities. This is Ilona Velarde saying goodbye for now. And please note that we have many other videos that explain about heart symptoms and heart disease. If you would like to have more information about this subject, why not buy or download our Heart Sense book, which is easy to read and contains useful information about the heart and the best diet to eat. In case you would like to read something more technical, you can buy our Eat to Your Heart content book from our websites. And you can also download this very short brochure, Worried About Your Heart, which explains many details about heart problems and which is available in 4 languages: English, Greek, German and Russian. Don't forget to purchase our Heart Sense supplement, which is essential to even the best diet. Soon we will also have Heart Sense tablets, which will be available on our websites. All our products and information are available on our websites, heartsense.com.cy and thecardiaccenteruk.co.uk.